WOCA. Ocala. Five minutes after 9 o'clock, and it's time for our visit. Every week we have a visit with this pretty lady right here. Bern Paraiso is in the studio, looking pretty in pink, with a pretty necklace on. Let me see what else you got. And the gold watch.
Oh, there you go.
And look, there's that smile that you're famous for. And you have some friends and family watching in the Philippines. I see the number a little bit higher than normal on the on the video feed. Bern is our medical reporter, medical correspondent. She's the president and CEO of GFA Inc., which stands for Good for All. And she lets us know about different doctors and health providers in Ocala and Marion County. Good morning, Bern.
Good morning.
Wait a second. Where are you? Now try it.
Can you hear me?
There, now I hear you.
Good morning, everyone. It is a beautiful, awesome Monday once again.
It is. It is.
A little cloudy, but traffic is good.
So do you celebrate Easter in your home? Is Easter?
Yes.
It is a holiday in your home? Okay.
It's like an annual event, especially for me.
Yeah.
For me.
Yeah, that's for us too.
I went to church.
Okay.
7 o'clock in the morning, and there's a Filipino, families celebrating every year at Cohadjo Park.
Oh, I didn't know that.
Have you been there?
Oh,
To-
yeah.
to the park,
Cohadjo
yes.
Park, yeah.
Yeah.
It's egg hunting, and there's luncheon after. There was actually a service yesterday, and I do not recall if there was a mass last year, but so in other words, I went to two different services.
Oh, really?
Isn't that awesome?
Huh,
That is
yeah.
awesome. We did
Anyway, yes, egg hunting was.
Ain't chocolate in your day? Did you have chocolate?
I am not sure. All candies, there must be chocolate.
Must have been chocolate there somewhere.
Absolutely,
Yeah.
I don't know what else is happening. Anyway, I had a lot of fun, and this has been going on for probably 5 years now.
Oh, wow. That's
So we all
a
go.
long party.
We all go, and thank God. Sometimes you just don't know if you can make it or not. But I made it. On time.
So is it family or just people?
It's sponsored by the Filipino American Association.
Oh,
We
okay,
have
okay.
over maybe 300 members here in Ocala,
Oh, really?
only in Marion County. Marion County. And our president this year is Raynor Koalas. Good morning to you. I was not sure today if he's an architect, engineer, and he told me that he will be on his way to work, and he will make sure. So if you're listening, good morning
Has
to
he
you.
had a colonoscopy?
Good question. But I think he's a little younger than most of us
Oh,
here.
okay.
But I should find out. Thank you for that.
I just know it always comes up on your show.
That's it.
It is, and actually it will, right now. Good morning to Central Florida Endoscopy Center, Doug Monteith, our clinical supervisor at the gastroenterology office. This is Dr. Vishnu Reddy, and I have an email that I received last week. This is from a patient, and this is from, her name is Sandra, and she
Okay.
said, please do not mention my last name.
Oh, okay.
Dear Bern, I have been taking phentermine. Phentermine is a weight loss medication.
Wow.
Oh.
It is a diet suppressant.
Okay.
Oh.
And my family doctor is not aware of it. And guess what? I have a colon screening scheduled next month. Should I tell my doctor about this?
Oh, wow.
Well, what a coincidence. Last week, we had 2 patients that were not able to get the colonoscopy screening because they were taking phentermine.
Same thing.
Exactly.
Oh, wow.
And this
Wow.
actually interferes with anesthesia.
Oh.
Meaning that the anesthesia might not work.
Exactly.
So she would be in pain.
Well, right, but
Okay.
Dr. Reddy would not.
Never do it anyway. so-
Exactly. So just to let you know, Sandra, that you have to be off for 2 weeks on this phentermine. This is not a blood thinner, but this is the only medication that you have to be off for 2 weeks because the blood thinner, or if
Oh,
you're
really?
right, so we have to have clearance from your a specialist on this one. But this phentermine, because it interferes with anesthesia and you are taking all the prep and it's not the best feeling ever, and then you arrive to the procedure center and of course it wouldn't work, and then you're wasting your time. So community, again, remember, please communicate with your family doctor. And also
I would think any medication he should know about, or
yeah,
she,
that's
right?
very important.
Well, exactly. And I do not know if I have enough time, because that would be my second discussion today about how important it is for you to communicate with your doctor. Your doctor is your partner. So the better able you are to communicate your needs and understand your options, the more productive your appointment will be. And, it's very likely that you are to get the treatment that you need. So prepare and address your questions. And also, you must understand your procedure. This is another thing when you go see your family doctor. When you are referred to get a mammogram or a colonoscopy, you know what I always tell, some of my friends, and when I do my visit to my doctor's offices, advise your patients when you confirm their appointment.
Right.
Because some of them, if they're first timers, they do not expect. Now, I advise the patients to please write down your symptoms. Then write down all your medications in such a way that, your visit to your doctor, because your visit would only last a maximum of 45 minutes.
Oh, is that right?
Between 30 to 45 minutes.
Wow.
So the phentermine is the only one that you have to be off for 2 weeks? The others you can stop later?
Yes, the phentermine. And this is not only colonoscopy. I think all kinds of surgery.
Really?
So you should ask or bring it up. Pick up the phone. And if you're not sure about what you should do. And again, it is important that you follow your prep. So if you're diabetic, if you're taking vitamin E, if you're taking blood thinner, you have a different prep for your colonoscopy. And again, the phentermine applies to any form of surgery that you're scheduled for.
Wow.
So you need to ask your family
This must be
doctor.
a powerful drug or whatever it is.
I actually was reviewing all the reviews on the phentermine. Some of the patients, actually, they lose. This is a weight loss medication, and it actually works in a lot of them. Because this patient, Sandra, she said that she weighed 175 pounds, and she lost 50 pounds for 3.
Oh, wow.
She's been taking this, and I'm not saying that it can work for everybody. We have different system.
Did you hear that aliens probably weigh 650 pounds?
Yeah. I know.
There's a story in Newsweek that says aliens are enormous. These outer space creatures.
Oh my God.
There's Newsweek.
They're doing a study.
Really?
Just thought I'd share that. Maybe they should get some phentermine up there.
That's right. They'll take care of it.
Well, that would be a good news. I have a very happy couple.
Do you?
Oh, before I
Couple of
forget,
what?
I just want to make sure that, again, please consult your doctor if you have any questions or question about phentermine, especially if you are scheduled for colonoscopy or colon screening. I have a happy wedding anniversary to Dr. Brian and Mrs. Rose Cregan at Open Arms Medical Center. I have to be fast. Also, a happy Monday to Dr. Jean Kerr and family. Also, greetings to Dr. N. Patel at the Ocala Internal Medicine Associate. And I had a visit with Joe Myers last week, and it was good. This is a very nice office behind the mall. And they also have Quick Hair, Dr. Raj Patel. What else? Our friends and family in the Philippines, good evening to you, Dean and Jeanette Batoktoy of Aurora, Zamboanga del Sur.
Oh, wow.
Pitogo family in Aurora and also Cebu City. We also have a happy Monday to Dr. Jean Kerr and family. Did I say that?
Yeah, I think you did.
Okay,
yeah.
I did. And last one is to Mrs. Mr. and Mrs. Romy Paulo and Christopher in the Philippines. So good evening to you all, and thank you again for listening and viewing, with my program this evening. And also to Ocala, good morning to you, and thank you all to all our doctors. It is 9:15, unbelievable, and this is April the 6th.
It is 9:15.
And by the way, children, they are back in school.
That's right.
See, I forgot. I didn't realize that.
1 week summer.
So they're done with their midsummer, mid-spring break, whatever they call it.
2 months, I believe, school will be
Out.
Be out.
exactly.
How old are you? How many children do you have?
I have one, and he's 7 years old.
7.
He's on the second grade.
Oh, nice.
Well,
You are
thank
so
you.
perky.
You got to bring
are
him in here one
wonderful.
day.
Yes.
One day he actually. Oh, by the way, he actually asked me if I could mention his name.
Okay.
So good morning to my son, James Anthony Keaton.
Ah, hello,
At
James.
Dr. Ennis Jones, and good morning to Mrs. Laffey. She's the principal.
What does he like doing? What's his like? Does he like music or drawing or sports? What does he like?
He loves to perform. Not into sports, but he needs to get started with that. He actually likes to do motorcycle.
Motorcycles.
The BMX.
Oh no.
So anyway,
Oh.
well, thank you so much. My time is up.
I'm
and-
sorry, Bernie. Well, we're just chatting with you.
Well, I know, and I enjoy this, Monday chat with you all.
It's our chat every Monday.
And I will be back next Monday,
It goes too
same
quick.
place.
Doesn't it go too quick?
And it is. And same time here with Larry and Robin at WOCA 96.3 FM and 1370 AM. I got it right.
Thank you, Bern.
Thank you.
All right, we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. It'll be partly sunny today with a shower or thunderstorm around this afternoon and this evening. The high today 81 to 85. And